Support for First Coast Connect is provided in part by Baptist Health and North Florida TPO.
Good morning, I'm Ann Schindler, and this is First Coast Connect. Today, with the largest rollback of federal health programs in history poised to take effect, the potential costs are starting to come into sharp focus. We break down what to expect and why experts are predicting double-digit health insurance increases. Later in the program, before the first slave sanctuary in the United States could be celebrated, it had to be rediscovered. We talked to the archaeologist whose persistence helped find and authenticate St. Augustine's historic Fort Mose. But first, health insurance companies estimate premiums for Florida customers could increase by as much as 40% starting in January. Here to help break down why is Scott Darius, Executive Director of Florida Voices for Health. Welcome back, Scott.
Thank you so much for having me.
We're also joined via video by Dr. Leonardo Alonso, an emergency medicine physician here in Jacksonville. Good morning, Dr. Alonso. Dr. Alonso, I think you're on. I don't know if you can hear me, but we're going to come back to you in just a minute. So, Scott, we hear a lot about property insurance rates and the possibility that they might increase. Health insurance is really the growing concern here, though. I mean, we hear about property insurance, but we're going to start hearing a lot about health insurance.
Yeah, I think especially as open enrollment starts here in November, the November 1st. I think part of what we're trying to do in having these conversations is making people aware that when they show up to sign up for their plans, when they try to renew come November 1st in this next open enrollment period, that they should expect to find that their costs have gone up significantly.
Yeah, well, what we're seeing is some reporting both by the nonprofit newsroom, The Phoenix, and by the Kaiser Family Foundation, which is an independent nonprofit that focuses on health policy research. 14 insurers in particular proposing double-digit increases for Affordable Care Act plans. This is according to a review of federal data. Now, these figures aren't quite official. Explain to us what happens. Typically, insurers are required to kind of publish their prospective rate increases, and we haven't really gotten the final numbers yet.
Yeah, so every year, kind of near the beginning of the year and around the summer, you have insurers who kind of evaluate the landscape and they set their prices for the next year. But before those prices become locked in, they have to submit them to, regulators. So we have the Florida Office of Insurance Regulation, and they review those rates. And typically, right, I don't want to say it's a rubber stamp. Typically, they'll move forward with it, whatever the insurers propose. But the insurers also have to include a justification for whatever they're charging. And so we all know premiums have gone up steadily over the years. Some years it's, I think there's always an increase, and some years it's smaller. I think what we're seeing this year already is a huge single year jump, right? That's what we haven't seen in at least 5 or 6 years, is this huge one-time jump in the numbers. But insurers always have to include a justification. And what we're seeing this time around is that they're specifically pointing to some of the changes in HR 1, the One Big Beautiful Bill, but also just some of the other things that are happening in the landscape, including the non-extension of the enhanced premium tax credits.
So explain to us what the premium tax credits are. There were some tax credits that initially helped subsidize people who wanted to go to the health gov. What is it?
Healthcare.gov.
Healthcare.gov site. That's the ACA, basically Obamacare. There were some incentives to help people enroll, and those were expanded somewhat during COVID. Can you explain what those, how those help people with premiums?
Yeah. So it's helpful to think of the ACA as a three-legged stool, right? They looked at the world, the U.S., and everyone above 400% of the poverty level, the federal poverty level. The thought was, hey, these folks make enough to qualify for health insurance and probably don't need any financial support. For folks making below 100% of the poverty level, the thought was, hey, we'll expand Medicaid and you'll have all these folks covered. But for people making between 100 and 400% of the poverty level, so people who we'd consider middle class or lower middle class, whatever it is, would probably need some assistance to keep up with the cost of monthly premiums and other out-of-pocket costs. So when the ACA in its original design included these tax credits for folks in the middle in particular, what we saw post-COVID, right, we all remember the world the way it was and the support that people really needed to afford things, especially as the cost of everything else seemed to skyrocket at the exact same time. And so in 2021, you had the American Rescue Plan that passed these enhanced tax credits. So on top of what folks were already receiving, we all received a little bit more support for monthly premiums and other out-of-pocket costs. And yeah, I think the impact from that it's in the numbers, right? Just the sheer amount of people we saw enroll in the marketplace since then.
I think we have Dr. Alonso with us. Good morning, Dr. Alonso. Can you hear us?
Yes, I can. Good morning.
All right. Good morning. Thanks for having us. Thanks for joining us here this morning. So we're talking about the possibility that we're going to see some significant increases in health insurance premiums. I mean, just based on the work that you've done here in Jacksonville over the decades, how is that going to impact your patients?
Well, impact them in a very negative way. I'm an emergency medicine physician, and I've practiced in Jacksonville and Clay County, Duval, for over 30 years. And a significant portion of the population who's uninsured uses the emergency department for their only access to care, which we all know is very inefficient in terms of expenses. And Medicaid is, I would say, depending on what hospital you look at in the community, but usually around 30% higher in the pediatric population. So you are cutting out a huge number of patients that would not have access without Medicaid to primary care, so they would go to the emergency department for emergency care, which is, like I said, much more expensive.
And so when they're seeking emergency care, practically speaking, how does that impair the work that you're trying to do with a patient? How does it impact the care that you're able to give them?
Yeah, that's an excellent question. Well, people complain often that the wait times in the emergency room are very elevated. And part of the reason is we use a triage system, so the sickest come first. It's not if you got there first, but if a lot of people are coming in with sore throats, cough, and upper respiratory tract infections, things that do need some attention, but not an emergency room where they could see, if they had insurance, the private doctor, now spills into the emergency department world, and this causes a huge overflow, backup, and it impacts everybody. People who do have insurance will then also have to wait longer often, and the whole system is overburdened. So, primary care is essential, and to have good primary care, people need insurance to pay for it because it's so expensive in this country. So, yeah, it all ties in.
How does it impact the work that you yourself do or your colleagues when you're overburdened like that?
Well, it's very frustrating because, as you recall, when COVID hit, they were telling people not to use the emergency department to allow us to see the sickest of the sick, and people really listened to that, and I applaud the public on that. But now when we're sort of back to normal, and as more, Florida is only one of 10 states that did not expand the Medicaid to fall under the ACA and capture. The estimates are 800 to 900,000 Floridians would be insured and now aren't because the legislature and the governor decided not to expand that. So that impacts me personally in that I'm seeing more people that do not need to be in the emergency room, but yet I have to see them. I can never deny them care. So it just overwhelms everybody. It causes burnout in nursing, frustration among doctors, overutilization of services.
Yeah. If you're just joining us, we are talking about what are predicted to be double-digit increases in health insurance premiums next year, unless Congress intervenes. If you have questions or comments, you can join the conversation by calling 904-549-2937. You can also email questions or comments to firstcoastconnect@wjct.org, or you can reach out on Facebook, Instagram, or Twitter at FCC On Air. So, Scott, in terms of, this spike, I mean, Florida is not alone. It is in good company. And in fact, just recently, NPR was reporting, an average spike of 75%. And they, talked to a patient that was going to see, basically a quadrupling of her own rates monthly. But Florida is uniquely vulnerable. And Dr. Alonso kind of alluded to why. But can you explain why Florida has a particular vulnerability when it comes to the changes that are coming down the pike?
Absolutely. I'll say there are two things happening at once, right? That maybe is worth spelling out. First, you have these increases in the base rate of what insurance is costing. You have these insurers who now are looking for between 20 and 40% increases in just what they charge normally. That's happening at the exact same time that people are losing these enhanced tax credits. So that's where that kind of double whammy hits, and people will get that sticker shock, I think, when they go to sign up for their plans. Now, Florida in particular, right? We have 4.7 million people currently enrolled in the marketplace. That's that leads the nation. And frankly, we've always led the nation when it comes to enrollment in the ACA plans. Just speaks to the level of need that exists here. But of that 4.7 million, you have 2.4 million of them who earn below 138% of the poverty level. So you have folks who, are very much at the lower end of the socioeconomic scale. What's happening though is, as you know, I think Kaiser Family Foundation estimates that 2.2 million of that 2.4 will just be priced out of coverage. Will just have no choice but to not get covered. But you suddenly have a doubling of our uninsured rate here in this state. Currently, in the last decade, we've done such a good job of reducing our uninsured rate down to 1 in 5 Floridians. If this hits, if 2.2 million people are priced out of coverage, suddenly our uninsured rate doubles. We go from 1 in 10 uninsured, to 1 in 5 uninsured. And so a huge vulnerability there. But we've also not expanded Medicaid, which would have covered folks up to 138% of the poverty level. So as these folks find themselves priced out of the private market, there's also no safety net here in our state to help them.
And so that was a decision that was made by our then governor,
Rick Scott back in the day.
right? But has been a policy that's been continued since then. And Florida wasn't the only state that refused to expand Medicaid, but other states that did have come back with citizen initiatives that have essentially reversed their governor's refusal and said, we want to expand Medicaid. Where does Florida stand in terms of trying to get that policy changed?
So I'll say the ballot initiative we've seen mostly in red states, in like conservative states where the people themselves are calling for it, right? And so Florida currently has a campaign, Florida Decides Healthcare, that's to put Medicaid expansion on the 2026 ballot. What encourages me in that work, right? It's still a tough climate to work in, but our most recent polling, we've seen close to 70% support for Medicaid expansion, and that's across party lines. In one of the polls we did, we actually, adjusted for the turnout. So we did a plus 13R, heavily conservative turnout, and still finished with 68% support for Medicaid expansion. And again, across party lines. And so it's a thing that people feel intimately, a need that people have, access to healthcare. And we'll just see how this, unfortunately, it feels like we're going to have to see this thing play out in the next couple of months before people respond and try to do something about it.
In terms of the widespread bipartisan support, I mean, it's been interesting to see a very conservative coalition here in Florida coming together to protest these insurance rate premiums, the ACA premiums doubling. And that includes Associated Industries of Florida, the Florida Hispanic Chamber of Commerce, and the Florida Hospital Association. So there is actually a group called Florida Conservatives for Affordable Health Care that has been at the forefront. They've been having press conferences. They've been having, meetings to discuss this and to urge both, more people being allowed coverage and also preventing this premium increase. I mean, what can Congress do, for instance, at this point?
So Congress definitely still has this option, right? Still has this ability to not expand, but to extend the tax credits, the enhanced tax credits. They technically expire at the end of the year, and they have the option of passing legislation either through one of the budget vehicles or just passing a bill that says we extend these. And so we're still calling on our members of Congress to act because it's not too late. It might change the timing of things, considering that open enrollment starts November, and these insurers have factored in the fact that they're not expecting the enhanced tax credits to come back, so there might still be some wrangling that needs to happen. But fundamentally, there's still a chance to help people get the things that they need. The interesting point you make about this conservative coalition that's come together, just in conversations we've had with a couple of them, right? The Hispanic Chamber in particular, they talk a lot about the reason that they're out in front on this is because of the impact that they see on small businesses. In Florida, without Medicaid expansion, and I think that's been the benefit for other states, where you have small businesses that are unable to provide group coverage to their couple of employees, they have been able to move people to the marketplace and either give them some sort of subsidy or some sort of stipend to help cover that, or they just have folks who are able to afford coverage in the marketplace. You have, in the technical definition of small business, there are people who are self-employed, right? Just folks who are working for themselves. And so the marketplace has been really helpful in encouraging that kind of economic involvement, or that people can get out in the workforce and do what they need to because they also have the security of coverage. And I think that's what scares folks like the chambers the most.
And we do, I mean, aside from people under the ACA, we're talking about just small businesses with fewer than 50 employees that are also going to be seeing pretty significant rate hikes. Is that right?
Absolutely. Like everyone's going to feel this in one way or another. And then just to make the other quick plug for Medicaid expansion is that in every state that has expanded, you've seen on average like a 7% decrease in the cost of premiums for people in the private market, right? It just changes the way the risk pools are set up, the thought that like, hey, we have more unhealthy folks or whatever it is in these covered by Medicaid and all the other things. And so the private market, we can price a little bit differently. So this idea that if you're not personally impacted by the prospects of Medicaid expansion, you're kidding yourself. I think we're all kind of like tied together in these things.
Yeah. Dr. Alonso, I wonder if you can talk about that a little bit in terms of how just an overall healthier population can impact, premiums or outcomes even when you're talking about, the entirety of the population and not just people who might be on the government ACA plan.
Sure. I want to tie into something that Darius just said is that right now health insurance is dominated by the 7 big insurance companies, Humana, Aetna, United Healthcare. Most of these know what these are. And the smaller local or statewide insurance companies depended on the marketplace. And if we eliminate the marketplace, these options, like he said, for gig workers and a lot of, people that are like Uber drivers or just small businesses dependent on these because the rates of these other ones are so much higher. But answering your question is, it's just that peace of mind that if you have insurance and we all know a family member suddenly getting ill or women suddenly being diagnosed with breast cancer and mammograms and the ultrasounds and all the testing, all this is very expensive out of pocket. And even with insurance, there's co-pays and deductibles. So insurance is not a guarantee, but at least it's sort of a buffer so that it doesn't throw a lot of people into bankruptcy. And I want to remind the audience, the number one reason that Americans go into financial debt and bankruptcy is medical costs. So insurance helps buffer that, and that's key.
I want to ask you because we got a question from Ed on Facebook, Dr. Alonso. He's saying at the beginning of the ACA, CEO of Mayo said everyone wants universal health care, low cost, and top high quality health care. The reality is that you can only have 2 of the 3 at the same time. If you have universal coverage and low cost, you can't have top quality health care. If you want top quality health care and low cost, you can't have universal coverage. Can you comment on that? Do you believe that analysis still holds true?
Well, healthcare is a very complicated subject, and we could spend hours talking about it. But I'm a big fan of universal healthcare. The question is, people in America think we have the best healthcare in the world, and the answer in a way is yes, if you have a lot of money. If you're very well off and you can pay all the co-pays and deductibles and get the top gold plan insurance, sure, this is an excellent system. But for the average American, this system is totally out of control and inefficient. So we are the only developed nation in the world that does not guarantee health care for everybody. So if you look at health outcomes in terms of infant mortality, longevity, multiple factors, access to health care, we rank around the bottom. And crucially, we spend the most. So you got to ask yourself, if we're spending more per person, per capita, it's about 18% of GDP. Most other developed nations are around half of that. And yet they cover everybody. Who is making the money? That's the question. So I think the key is not having the fanciest gizmo and laser and cyber knife, and you'll hear about all this robotics. But if people can't even get care for the 2 biggest conditions in America, which are hypertension and diabetes, if they can't get their pills, their insulin shots, the basic stuff, none of this glamorous baboon heart transplant and stuff that you hear in the news, it's amazing. Well, if most Americans can't get the basic stuff, I argue, well, what's the point of all this fancy stuff if that's just a small slice of the big pie? We should try to benefit the most people.
Scott, Darius, in terms of what people can do at this point, first of all, I'm just curious if you think that the state has done an adequate job of letting people know that this is coming, whether people can do anything to weigh in on it before it happens if they are concerned about these soaring healthcare costs.
Yeah, sometimes it feels like such a technical issue, right? To explain to people, hey, it's your tax credits that are going away. Yeah, that just it doesn't land, or we haven't been doing the work of like getting that in front of people. My big concern is that people won't see it or feel it until they sit down to review their plans for next year and they realize, oh wait, I've been getting tax credits that have made this plan like so affordable. So that's what we're doing now is first just trying to get this information in front of
Do you
folks.
think most people know that they're getting tax credits?
I'd like to think that they at some point knew, right? Like while they sat down, hopefully with a navigator or whoever they worked with to sign up, at some point realized, hey, I'm getting a little extra credit, and that's why it's been so affordable for me this year. But it's an easy thing to forget. I'll say that. You just kind of get into the rhythm of paying your bill, you feel good about it, and you walk away from it. It's when you sit down again and you realize, oh, maybe things have changed for me, right? Like maybe your work has changed or other like life circumstances that were going to impact how much you pay anyway. But then you realize that there's no additional help regardless of what's happened to you. So yeah, it's that really tough moment that we're trying to put in front of people before we get to that point, and mostly because there's something they can do about it right now. Folks can contact their congresspeople, both your House of Representatives and senators, and encourage them to do something about this in the coming months, especially as folks return back to DC, I think this week or next week. So yeah, there's an opportunity and a moment for it. But while we're not, yeah, I don't want to encourage people to to just do that. There's this Medicaid expansion ballot initiative. That's a very concrete way for us to get involved and help provide care to what we're now estimating to be over 3 million Floridians who would need the access to care if we lose the aid tax credit. So yeah, just encourage people to check out FloridaDecidesHealthcare.com.
We've got a call from Daryl in St. Augustine. Good morning, Daryl. Go ahead.
Yeah, good morning. Just like the physician just said there, universal health care is more efficient. It's better for the entire country. Profiting from the ill is not a business model. And that's what we're doing. We're trying to find ways to make money from sick people. Sick people don't pay taxes. So it's in our best interest to have universal health care so everybody gets up, goes to work, pays their taxes, and our economy is successful. This idea that you make money from sick people is a little absurd in any other country in the world.
Thanks, Daryl. Appreciate that. Just finally, in terms of the timeline, I mean, I mentioned, Scott, that these are not final yet. We're still sort of waiting on this insurance review and then those rates to be formalized. When do you expect that to happen?
October. Usually in the first couple weeks of October, you'll get the specific plans for the specific prices for each specific plan that's in the marketplace. I think a lot of the plans themselves have changed. A lot of times, right, in the last few years, you've seen plans kind of carry over from year to year. You might get some slight changes, but yeah, generally the same plan has been available over time. I think that's shifting a lot just based on all the other things happening in the landscape. And so we'll see a final kind of look at it, I believe, in the first week or two of October.
Soon before open enrollment starts. Well, Scott Darius with Florida Voices for Health, Jacksonville Emergency Medicine Dr. Leonardo Alonso, thank you both so much for being here. Really appreciate it.
Thank you so much for having us.
Thank you for having us.
All right. Up next, the archaeologist who literally excavated the first free black town in the United States. We ask Kathleen Deegan about her new book on Fort Mose. Welcome back. It was the destination for the first Underground Railroad, a sanctuary for families fleeing slavery, and the first free black community in what is now the United States. But this enormous piece of American history was nearly lost to time and development. I'm joined now by Dr. Kathleen Deegan, the archaeologist who literally excavated Fort Mose and in so doing saved it. She is also the author of a newly reissued history of the place, Fort Mose, Colonial America's Black Fortress of Freedom, which she co-authored with Darcie, MacMahon, and Jane Landers. Dr. Deegan, thank you so much for being here today.
Oh, thanks for having us.
So, first of all, congratulations on the book. It is a beautiful piece of artwork. It is a beautiful piece of writing. What prompted your decision to update and reissue the book?
Well, the book was first published 30 years ago, and since that time, so much more has been learned about Fort Mose. Dr. Jane Landers, who was actually a graduate student on the original project, has continued to do research, and the Fort Mose Historical Society has been formed and has done tremendous things, and the Florida Park Service has built a museum, and so the work has gone on, and we wanted to update the book to reflect all of these new information.
I want to talk more about the work that Jane has done because it has really expanded the story. But for people who aren't familiar with just your trajectory here, you actually started working on the site back in 1971.
That's right.
That's extraordinary. And so, that original research at that time, remind us of what the kind of what the mood was, what the knowledge was generally about Fort Mose, what the reception was, and kind of what you were trying to show when you first went out there.
Well, I was actually a student myself with my professor, Charles Fairbanks, who was eager to locate Fort Mose. It really wasn't known at all outside of academia, and there were a few historians who had written about Fort Mose, but we wanted to locate it and see if we could learn more about daily life of the people, or just learn more. And we thought at that time that we had found a site thanks to Mr. Jack Williams of St. Augustine, who owned the property. But many years went by before funding could be found to actually study it.
Yeah. And so there was some, I guess, resistance to the idea of Fort Mose. And it may be hard for people to put themselves back in that time, in that place. But remind us what St. Augustine was like back then and why there was some resistance.
This was only 5 years, 6 years after the problems with the Civil War, Martin Luther King coming to St. Augustine, and the marches and violence. And so it was still a little raw, I think. And a lot of people just didn't believe in Fort Mose. They just didn't think that was a thing. And some of us were sort of accused of making this up to get state funding, because ultimately we got funds from the Florida legislature, thanks to Representative Bill Clark and the Black Legislative Caucus, who believed in it and helped us demonstrate that this was Fort Mose. But there was some discontent, and that this was just something we were making up.
Yeah, I mean, it's maybe hard for people to believe because there's a lot of emphasis now in St. Augustine on Black history and, this Black Heritage Trail and all of the sites that were important in the Civil Rights Movement. But the idea that people didn't actually believe in Fort Mose does seem hard to imagine.
Yes, it does.
Yeah.
To me, certainly. Well, it's a very different story of Black history. It's not about slavery or plantations.
Yeah.
It's really about the fight for freedom, the resistance, and the determination to be free. And I think that's not a story you hear a lot in American history in textbooks. So it was perhaps a little bit difficult at first.
I want to read a little bit from the beginning of the book because I think this really encapsulates what you're saying there. You wrote, most Americans think that African-American history began in 1619 with plantation slavery in English colonies, and that this determined the fate of Africans brought unwillingly to America. Fort Mose's history challenges that narrative. It is instead a story of the relentless pursuit of freedom by politically astute people of African descent who made effective choices to realize their vision of self-determination. And it continues, the African experience in colonial history was much more than slavery and oppression. So the story of Fort Mose really is a story of a free Black community. Remind us about how it was sort of the original southern terminus of the Underground Railroad.
Yes, the original people who came to St. Augustine to to establish Fort Mose had been enslaved in South Carolina plantations, and through word of either Native American networks or African networks, they learned that if they made it to St. Augustine, they would be given sanctuary
And that was because it was under Spanish control.
under Spanish control. In fact, in 1693, the King of Spain issued a proclamation saying that if anyone came to Florida or made it to Florida and became Catholic, they would gain their freedom. Um, both the men and the women, he specified. And so by 1720s, there were about 150 people who had made that trek, and they often came with Native American guides. They were brought here going south instead of north with Native American allies and guides.
And you say that this was Florida's brief experiment in progressive society. This was the first free Black community in the United States, but it wasn't the only one under Spanish control in the world. There were other similar Spanish colonies like this in Panama and Venezuela, in Hispaniola, places where people of different races and ethnicities lived together as Catholics, but with relative equality.
That's absolutely right. And Fort Mose is exciting to us because it's in our state and it's a unique story in American history, but it's connected to a much wider world of people and policies. And mostly this happened in the Spanish colonies of the Americas. And I think largely due to the influence of Catholicism.
Yeah. So back to the beginnings of your excavation. You started there in the early 70s. It wasn't a consistent timeline of working out there.
No, we actually didn't begin major excavations until 1984, when we were able to get funds to continue the work, and worked there through the end of 1985. But we had to abandon the project in a sense because of the conflict between the landowner and the state of Florida. Florida, the state, wanted to acquire that as part of the public domain. And as you can imagine, when one person gets an appraisal for a land value and another gets an appraisal, there's always a little difference. And so there was a quite a big difference in that case, and we were asked to leave the site because of that. So that was a problem, but we still had a lot of funding. And what we did, and this is where Darcie MacMahon came into the project, we, at the Florida Museum of Natural History, developed a large traveling exhibit on Fort Mose that traveled the country for 11 years and had to come back and be refurbished. And meanwhile, the state was able to acquire the property, unfortunately, through eminent domain, which was not ideal.
Yeah, I mean the dynamic with the property owner at the time, I would say, was a very dynamic dynamic. I mean,
Yes.
Jack Williams was, a little bit of a contrarian. He definitely was a character. He had been digging on that property himself relentlessly because he was interested in sort of a later occupation of the fort.
The site of Fort Mose, or the ruins of Fort Mose, had been used by the so-called American Patriots, a group of kind of renegades who wanted, or they weren't all renegades, but a loose group of soldiers and mercenaries who wanted to acquire Spain for the new United
Or
States.
acquire Florida.
Florida, excuse
Yeah,
me,
yeah.
Florida. And so there was kind of the part of the War of 1812 in Florida, the Patriots' War, they called it, and Fort Mose was a base camp for that. And that was really Jack's principal interest,
Yeah, so he was interested in relics from that era.
that era.
He was less interested in the Fort Mose story.
Considerably less interested.
Yeah, and what do you
But he
attribute that
was,
to?
I don't think probably he or many people at that time related to that as really part of our history.
Mm-hmm.
There was, I mean, in North America, I've always been just bemused by why more people still don't know and understand what Fort Mose was about, even after the traveling exhibit. And we've done dozens of teacher workshops over the years. And it hasn't seemed to resonate or really grip the public imagination in the way we always thought it would. But that may change, I think, now that the Park Service and the Fort Mose Historical Society have created this representation, life size, of the fort at the site. And I think that's maybe bringing a lot more attention to it.
I know that there's the archaeological elements of this dig and finding what you found out there, all of the, pottery and the flint stocks and anything that has been discovered out there has been recovered through really arduous labor. Can you explain the work, how it's had to progress, sort of the delicacy that it requires to find things specific to the Fort Mose period?
I'm glad you asked that because it really was a delicate situation because the site had been occupied before Fort Mose by Native people and afterwards by Minorcan farmers. And so the Fort Mose lair of the place where their uh, refuse was laid down, where they dug holes and put posts, was about maybe a 6-inch thick layer in about 2 meters. So it did require hand digging with brushes and shovels and just water. We water screened put everything through water so that we could really see right at the point what was coming up. But that's, I think, a general process in archaeology. You dig about 2 inches at a time and stop and look at everything.
Yeah.
But it takes a long time to do that.
And so it's labor intensive, but even getting to this site back when you began working on it was difficult. It wasn't like you could just, I mean, it's surrounded by water. You would have to kind of wade through the marsh and the muck with your students or, on your own.
That was the case, and it was everyone just got high boots, and we marched. Sometimes it was knee deep, sometimes it was just mud because it was a tidal area. Interestingly, the whole area around that fort, which was somehow preserved, was dredged out by Henry Flagler to provide the fill underneath what's today Flagler College and Cordova Street in St. Augustine. And it wasn't always that wet, but it is now. And getting to the site was arduous. And I remember carrying our wheelbarrows full of things in and out when the water was too high. And actually, Flagler College has picked up the mantle on working at Fort Mose. Dr. Lori Lee had several field schools there, and they had to go all the way to Volano Beach and over by boat every day to get to Fort Mose, which was very time consuming.
I want to return to Jane Landers because she did some research, I think, in Spain. And in terms of like, was Fort Mose real or not? For a long time, people didn't think that there was a record of it, any written record of it, or not much of one. And she was able to find a lot more. Can you talk about the work that she did?
Well, that's exactly right. I think so many people thought, well, it's a community of formerly enslaved Black people. They couldn't read or write. There's no record. We don't know anything. And Jane, even as a graduate student, as part of our first project, went to Spain to see what could be found. And she found a tremendous amount of information. And it kind of goes to show that if you're not looking for something in some of these archives, you probably won't find it. But she found the names and birth dates and places of origin of all the people who lived there. She was able to locate letters written by the leader of the Fort Mose militia group, Francisco Melendez, who was really a larger-than-life character. He was literate and just descriptions of the buildings. So we actually had a much more detailed picture of Fort Mose because of that work.
And I mean, Francisco Menendez, who's not related to Pedro Menendez, but was a free Black who came from Africa and really was sort of a swashbuckling figure.
Very much so. He was a Mandinga and came to Carolinas and escaped. Actually, he escaped early and fought against the English with the Yamasee natives in the Yamasee War, and came with them to St. Augustine and went through a whole series of things. But he was appointed as the captain of the militia at Fort Mose. There was a free black militia.
Spoke 4 languages.
At least 4 languages,
Yeah.
and went off to become a privateer, attacking British boats.
And led the Battle of Bloody Mose, is that right?
That's right.
And so that was a seminal moment in the history of that fort where basically the occupants were chased out by General Oglethorpe and the English and then retook it in a really kind of brutal campaign, but got rid of everybody and sort of reclaimed it.
Right. The people of Mose were evacuated when the Spanish realized that the English were coming. Oglethorpe was coming, but the English took the abandoned fort as a headquarters, and the Spanish and African troops kind of crept up overland and retook it. And it was, by all accounts, a very bloody battle.
Yeah, and that's something that is reenacted now on that site
Yes.
pretty much every year. I wonder if you could just talk about how this has changed conversations in the community overall when it comes to race. It's always been a difficult topic for St. Augustine.
It has, but I think to me, the Fort Mose Historical Society, which really was founded based on the verification of the fort and the archaeology that was done, has changed the dialogue tremendously. And it was the first organization I belonged to in St. Augustine that had black and white community members all working for the same thing. And it was remarkable. And I think it has led to a lot now. Black history in St. Augustine is done in many different ways. We have the Excelsior Museum, the Accord, there's the Black Heritage Trail. And I think that a lot of that has been the impetus of that particular group. So I give them a lot of credit.
And that's a group that you were formative in founding, just in the same way you were formative in discovering this fort. I mean, I imagine you must be very proud considering not just the discovery, what it's meant, but kind of how it's broadened the conversation around race in St. Augustine.
Well, thank you for saying that, but it's true. I think of all I've been around a long time doing archaeology and have done a lot of work over the years, but I really feel that Fort Mose, in a way, is the most important thing that my colleagues and I have ever done, because it actually made a real difference in what we understand and how we interact with each other. And I can't think of any other project here or in the Caribbean that has done the same.
Well, Dr. Kathleen Deegan, she's author of Fort Mose, Colonial America's Black Fortress of Freedom, and the archaeologist who discovered Fort Mose, helped us all know that history. Dr. Deegan, thanks so much for being here.
Well, thanks for having me.
All right. Up next, fighting hunger on the First Coast. We talk to the head of a lead local agency, why this National Hunger Action Month comes at a critical time.
Terrell Hogan Law.
I'm Wayne Hogan. One text or call can wreck it all. Learn more through distracted driving presentations for teens and the workforce. Arrive alive. Let's end distracted driving.
More at terrellhoganlaw.com. Florida eye specialists and WJCT present advancements in laser vision correction surgery with Dr. Akbar Hassan, a cornea, LASIK, and cataract specialist, at a free lunch and learn on Wednesday, August 27th. Registration at wjct.org/events. AEG presents Camp. The Columbus, Ohio-based indie band will bring their folk-inspired sound and rich harmonies to the stage at the St. Augustine Amphitheater on Tuesday, August 26th. Tickets available at axs.com.
Listen to Anthology on 89.9 HD3 and let the music unlock your memories. All your favorite music from the 60s, 70s, and 80s. are always on 89.9 HD3 Anthology.
America's boys are falling behind in school. We're launching a special series to find out why. Episode 1, How Do Boys Learn?
He told the teacher, this is boring. And he said he wanted to go home.
He calls it 6 cruel hours of our lives, an acronym for school.
Don't miss the start of Falling Behind, the Miseducation of America's Boys. That's on the next On Point.
Today at 11, here on WJCT News 89.9.
President Trump says he wants to stop states from using mail-in ballots and voting machines, and he's preparing an executive order to do just that. It's the latest effort by the Trump administration to change the voting landscape ahead of the 2026 midterms. But what power does the president have to reshape our elections? That's the question for the latest installment of our politics series, If You Can Keep It, next time on 1A.
Today, starting at 10 on WJCT News 89.9.
Welcome back. Feeding Northeast Florida is both its name and its mission, and the group's president and CEO says September is a key time for both. Susan King joins us to talk about National Hunger Action Campaign, which starts next month in September. Thank you so much, Susan, for being here.
Oh, thank you so much for having me.
So this is an annual campaign every September. Remind us, if you will, kind of what the goal is of setting aside a month to emphasize food insecurity and the needs of the community.
Yes, this is a national awareness campaign, and it really is just to put a focus and a spotlight on hunger as an issue in our country, and then more specifically into our communities and the 12 counties that we serve here.
Yeah, so you serve a Northeast Florida footprint. What is the need? What is the situation in Northeast Florida in particular?
So we are North Central and North Florida. We go all the way to the Gulf Coast on Levy County.
Oh, wow.
And so
okay.
a fairly broad area, the size of New Jersey. And so a hurricane season comes, and we feel now that we are constantly in hurricane mode. But Hunger Action Month is really a chance for us to look at where we are in food insecurity and where we want to go. So for us, we have about 320,000 people identified as food insecure in our service area. That is 1 in 7 adults and 1 in 5 children. Frightening numbers. And that is up 17% from this time last year. So it's a growing problem. It's a quiet problem. Unlike during COVID, where we saw long lines of people in cars waiting for food, hasn't been the same illumination on the problem because it's sort of just drug on post-COVID. The financial pressures and inflationary pressures that families felt, the increase in rents and the increase in food prices has just sort of snowballed into forcing a lot of families, working families most specifically, into a time when they need assistance, when there's an emergency, a car repair, a big bill, a few days out of work.
Remind us what food insecurity, what is the definition of it?
So food insecurity is most broadly is when you don't necessarily have a food supply, steady food supply that you can count on. So maybe it's a couple of meals a week that you miss, and there are people who miss meals every day, people who are making decisions about whether to take medicine or to buy groceries in their house. So there are degrees of food insecurity, some very extreme and some that are just, like I said, there's a time when you can't quite make those groceries or the money runs out before the end of the month.
And so we know that, hunger, food insecurity has a lot of faces, and you've sort of got some themed programs that address the different groups that are impacted. Can you kind of walk us through? I know that, you have some specifically that are geared towards kids and teens, some that look specifically at seniors or members of the military.
Absolutely. So in terms of the military, we do distributions twice a month at both Mayport Naval Station, supporting that facility for active duty military, and also at NAS Jax, specifically those. We also support a number of agencies that support veterans groups, and so we specifically are always looking for opportunities to assist there. We do a lot of programming around kids, especially in the summer, trying to meet the needs. We held an event this summer to pack 10,000 snack packs for our summer programming. bringing in corporate partners and community members to do this so that people feel engaged in that work.
And those kind of go home with kids with snacks and nutritional items that
Yes.
that basically they can bring if the family isn't able to rely on, like, for instance, lunch programs.
Yes, when children aren't in school or aren't receiving lunches, but they are included in some academic programming in the summer, we try to fill those needs too.
Okay. And then for seniors, you have somewhat of a different program because they also have different nutritional needs.
Yes, we do a nutrition pack that is specifically geared towards seniors, and we distribute those through um, agencies, through other organizations, boots on the ground that are dealing with seniors. So we're really the food provider, if you will, the logistics warehouse distribution arm, and we work with almost 500 organizations, agencies, programs in our 12-county area.
So I've got to ask, I mean, there's many agencies, nonprofit, for profit, that are in various ways experiencing changes in policies when it comes to things that they've, traditionally used or counted on. And I'm guessing that the food supply and funding for it from the federal government and possibly the state government is also changing a lot for you. How is that impacting you?
So for us, the things that we've actually felt and seen and felt and have had occur is a reduction in funding from the Commodities Credit Corp, which went through the USDA's TFAP Food Assistance Program. For us, that was approximately $850,000 worth of primarily proteins that we had ordered through this program and anticipated in our budget and our planning. That was early on in the administration. We also have seen a cut in a program that was designed to support local small farmers. Primarily, it had been really successful over the last 3 years. LFPA program, it's a USDA program, and that funding was $1 billion nationally, which was cut and effective September 30th. We've also seen that a SNAP education, which is a nutrition education program that administered through the Department of Children and Families here in Florida, has been cut. And so that will eliminate long-standing nutrition education, which helps us enhance the work that we do.
Susan, just briefly, where can people get information if they'd like to help out?
Our website is the best place. That is feedingnefl.org. And we have lots of resources for people who are looking for food and lots of ways for people to be involved.
All right. Well, Susan King from Feeding Northeast Florida, thanks so much for being here.
Thank you so much, Ann.
All right. And thank you for listening. Join us tomorrow when we talk to the investigative reporter who helped exonerate an innocent man and convict the guilty one about in his new book about the Camden County, Georgia murders. I'm Ann Schindler. You've been listening to First Coast Connect on WJCT News 89.9.
Support for First Coast Connect is provided by Baptist Health and the North Florida TPO.
Baptist Health is a proud supporter of First Coast Connect. Baptist Health, committed to building a healthier community for all of us. More info at 202-4YOU or baptistjacks.com. The North Florida TPO is committed to shaping our transportation future. We're focused on planning, funding, clean fuels, and new technologies for a vibrant, connected community. Learn more at northfloridatpo.com. Clay Today is a multimedia publication offering Clay County residents information on news, sports, business, and community updates. More information and details at claytodayonline.com or claytoday904 on Instagram.